finding the right doctor. All right, what is going on, guys? So today I'm going to be talking about finding the right doctor. What I mean by that is finding someone who's going to be able to help you understand your problems, understand you and your emotions, and someone that you understand. I'm going to be sharing the struggles I had when I first started to seek help from doctors in terms of my mental health, specifically in regards to depression and anxiety. This is basically it. So the first problem I found when I was trying to find the right doctor for me was just getting the notion or idea in my head that I even needed help from a doctor, from a professional at all. And so what I mean by that is basically that I would have days that fluctuated so much from a good day to a bad day. My days would be fluctuating in a way that, some days I would wake up and I'd say, I definitely need to get some help. I need some help with this issue or whatever it is. I would maybe call and make an appointment. But then part of my problem was on good days, I would kind of feel like, maybe I don't need help. I can deal with this on my own, or there's not really even much of a problem, things like that. And then I'd either, cancel my appointment or forget about it. And, it wasn't a really good cycle just because I never really got the help I needed. So if you felt like that in the past, or if you feel like that right now, my biggest piece of advice would be, if you feel like at any point you probably need some help, then you probably need some help, and that's okay. You can go out and get some help, and even if you go and you feel like once you get there, maybe this is a little bit different from what I expected, or, it's not helping me in the way that I wanted it to, then at least you've tried that route. At least you've kind of given it a shot, and you kind of know what isn't working for you, so you can start to work on what is working for you. Once I kind of decided, this is something I definitely need, this is something I should do, essentially, dude, something just fell on my car. Anyways, essentially what happened was I worked up the courage to go. I made an appointment to go and see this doctor, and it was really difficult. I ended up getting in to see him, and it was the first time I had finally opened up about depression or anxiety to a professional. And I ended up just sitting in his office and crying for about 20 minutes. I tried to find words to express how I was feeling. The result wasn't the best for me, because basically he told me that he wasn't taking any more patients and he didn't think that he could help me. And at first I was really bitter about this, but I do appreciate him saying that to me, because I could see there being a pretty big issue if I did get, involved and started to get attached to some sort of help there, and then it get cut off because either he's going to retire soon, or he had too many patients and wouldn't be able to take me on and give me the care that I needed at the time. So it sucked. It was demotivating for me, just because I had finally gotten the courage to go in and see someone, and then I didn't get the result I was looking for. So essentially after that, I gave up for a few more weeks. I think it could have even been a couple months. And then I had hit another rock bottom, and I got to the point where I was like, okay, look, I don't care that I'm not comfortable with my family doctor. At this point, anything will help. So I went to my family doctor, and she started to help out, which was pretty cool. It started helping at first, and then she referred me to a new psychologist. And then that was the third doctor, I suppose, I talked to about my mental health. And that was when I started using, antidepressants and anti-anxiety medication. That's where a little bit of a roller coaster started for me, because even though medication can help for some people, it's really life-changing and it really, really helps them. I ended up having a lot of weird side effects to some medications, and I ended up bouncing from medication to medication. Probably, they make you do it for about 6 to 8 weeks. So a 2-month span of each medication, I jumped from medication to medication for about 8 to 10 months. And it wasn't a fun experience. I didn't really find one that worked for me. In fact, I was really frustrated with the side effects that I did get. That doctor eventually started to make me feel pretty uncomfortable just because I had explained to him my fear of continuing this cycle of going on medications and coming off of them and then trying new ones. And at the end of the day, you know, our relationship just didn't work out, right? So I stopped seeing that doctor as well, which led me to basically a path where I was really confused and lost and alone because I didn't know where I could go. My family doctor had already given me her recommendation, so I felt kind of lost just because, you know, I bounced from doctor to doctor, from medication to medication, and nothing was really working. I ended up getting referred to a walk-in clinic just because a friend of mine told me that, you know, she had gone there in the past and she had gotten help, and so I was feeling pretty optimistic about that. So this was probably the fourth doctor that I had gone to see now, about like 3 or 4 years basically. So this is doctor number 4, and doctor number 4 was kind of a funny character. We got along well. I liked her quite a bit, but there was some things that were kind of disheartening that she said to me. I remember the first time I had ever seen her, I explained, you know, my depression, my anxiety, my history, and I remember her basically saying something to the effect of, like, you know, basically you have like your social life figured out, you have your career figured out, you seem like you're like in a positive mind state, so like I don't really know what you have to be depressed about. And that's kind of the way she phrased it to me, which kind of felt disheartening. Don't be so ungrateful for what you have, which there is truth behind. But for me, someone that was going out struggling to find someone to actually understand their issues and problems, it was a little bit disheartening for someone to tell you, you know, basically you have no reason to be depressed. She ended up kind of essentially doing the same thing that my family doctor did, which obviously I think is the right thing, which is she referred me to someone else who might be able to help me a little bit better. You know, family doctors or general practitioners are exactly that. They're pretty general based, and so what she had in mind was you should probably be seeing a psychologist. And then she referred me to my current doctor, which is awesome. I can't really say his name or where he works or anything like that, obviously, but my new doctor and I are working together, and it's going pretty well. I like him a lot. The reasons that we get along are pretty simple. We have a good understanding of each other. He asks a lot of questions, and I do as well, so we end up having pretty good conversations together and understanding each other quite a bit. We do have a lot of trust between each other. I trust him. I trust that he has my best interests. Doctors have certain responsibilities, but as a patient, you also have certain responsibilities, right? And so you want to be able to make sure that you're being honest with your doctor and telling them, you know, this is working for me and this makes me feel uncomfortable. You also want to just be able to kind of trust each other, right? So that's kind of where it all comes down to. And the point I'm trying to make with this video isn't that, you know, all doctors are bad or only some doctors are good. It's just that it's kind of like a one-size-fit-one. It's not a one-size-fit-all. Not every doctor is going to be the best doctor for you, and a doctor that works for you isn't going to work for everybody. So there is going to be a doctor out there that's going to help you out. You don't have to worry about that. It is a big struggle finding them, but once you do, it's really rewarding, and the relationship that you kind of build with them is really cool. It can really help you out a lot. One of the other things I really like about my current doctor is he starts to recommend books, podcasts, and different things you can listen to on the internet, basically so you can start to educate yourself a little bit more on certain topics, but also so that you can get a good mindset going and a good pattern going in your life as well. So that's pretty cool. I want people to just not be discouraged if they find that maybe their doctor doesn't understand them or they're losing hope thinking that people can't help them. There's someone out there that can help you out, and you're not alone. I struggled with finding the right doctor for myself, and I know that there's probably other people that are feeling the same way. I don't want you to get discouraged. I want you to continue looking for the help that you need if you are struggling. But at the end of the day, no matter what, you will find someone that will help you out if you continue to look. The odds of you finding someone that's going to be able to help you out if you stop looking are very, very low. So don't lose hope. It might suck right now, but you're going to get better. and the only real way to get better is to get help sometimes. So I just don't want anyone feeling like they're lost or alone in terms of getting help, because you can always get help. It might just take a little bit of time to find the right person to help you out. It sucks, but it's really worth it in the end if you can find someone that can really help you out. So don't lose hope and just try different things. There's help out there, and you just have to continue to look for it. And not everything's going to work for you, but something will. Thank you for watching.